Good evening, folks, and welcome to the Regent Park TV radio show. And my name is Murshida. I'm one of the ambassadors for the Regent Park, and I have a lovely doctor here with me. Her name is Aisha Khatib. Am I saying it right?
Khatib.
Khatib.
Yeah.
Khatib. Sorry about it. Welcome, Aisha Khatib, and she here to discuss with us for the monkeypox. And we did a lot last week about the COVID vaccine, how to protect yourself, where to get the vaccine, and why should you guys need the vaccine, and then all that stuff we were discussing about it. And then this time we were here to talk about monkeypox. Welcome, Aisha. Can you please tell me a little bit more about yourself?
Perfect. Thank you so much, Murshida, for having me on the show today. So my name is Dr. Aisha Khatib, and I am specialized in travel and tropical medicine. And I also work in a sexual health clinic here in Toronto. I'm an assistant professor with the Department of Family and Community Medicine at the University of Toronto. And I've done some work here in Regent Park, along with the COVID vaccine clinic. So I might have seen some of you guys there and vaccinated some of you guys there. So it's a pleasure to be on the show today.
It's really a pleasure to meet you today. Thank you for coming in. And I had a little bit of research done about the monkeypox, and I know it exists in the South Africa, and especially there's two part of the Africa that's where they exist. To be honest, I just happened to know about this, and I happened to hear that there's like a more spreading going around and everything. Would you like to explain what is monkeypox and how did they discover, and who's, can you please explain about
Sure. So monkeypox is a virus from the orthopox viruses. So it's kind of a cousin to the smallpox virus. And it's endemic to certain places in Africa. Endemic meaning that's usually where infections are local and present. So it's unusual for us to be seeing monkeypox in different countries outside of where they typically are. So the typical strains for monkeypox are found in West Africa and Central Africa. It was originally identified in some research monkeys in 1958, which is why it's called monkeypox. And it's a virus that jumped from animals to humans. So it's something we call zoonotic, as when the virus can go from animal to human, and you can have human to human transmission as well. The first time it was noted in humans was in the 1970s in the DRC in Africa, the Democratic Republic of the Congo. There are two lines of monkeypox. One is what you'll hear as the West African clade, and one you'll hear as the Central African clade. And the one that we're seeing right now in these outbreaks around the world is predominantly the Western African clade, which has a lower rate of mortality compared to the Central African clade. The misnomer for monkeypox is that it was first identified in monkeys, but the reservoir is actually rodents, so small types of rodents, squirrels, rats are going to be more where the virus is originally harbored.
Oh my gosh, that's scary a little bit. So, can you tell me what is the symptoms of the monkeypox?
Sure. So monkeypox, the reason it's called monkeypox is it's in the family of what we call pox viruses. So similar to smallpox or chickenpox, monkeypox is known to present with a rash that looks like you've got pox lesions. The virus itself usually incubates, or basically the time of exposure from the virus to the time where you present with symptoms is usually 21 days. And then somebody can present with what we call a prodrome of symptoms, meaning they can have symptoms such as headaches, fever, feeling tired, muscle aches, enlarged lymph nodes, or like feeling swollen in your glands. And then usually what happens is 1 to 4 days later, you can present with a fever and a rash that develops. And these rash usually start off as smaller, what we call macules or papules that kind of look like pimples. They can get bigger, and then they can start to kind of indent or umbilicate, and they can what we call vesiculate or turn into little blister-like pox lesions that then ulcerate over time, and then they scab over. So the time frame from when these blisters or these poxes develop can be anywhere between 2 to 4 weeks until they completely scab over. So that is predominantly the symptoms of it. You know, they've been mostly seen in this outbreak in kind of localized areas of the body, usually on the face, the hands, the arms. It can be in the genital areas, and it can be quite painful.
So since you said it's a pox, because I know there's like nowadays kids are getting like, the hand, mouth, feet. They also are like a little pox too. Like, how I'm like, how do they differentiate it? Like, between monkeypox and then those pox?
Right. So hand, foot, and mouth virus is what you're talking about. And there's also things like chickenpox, and there's also things like herpes, and there's other sexually transmitted infections such as syphilis and herpes and gonorrhea. Sometimes these can all present with rash that can have these lesions that look very similar. And so it's really important to really, if you have a rash that develops with these symptoms, kind of with this prodromal symptom of the fever, the muscle aches, the headaches, not always, but definitely, especially in these areas where you're concerned potentially for monkeypox, it's important that you seek out to your health provider, because it would need to be tested for to differentiate it. The difference for hand, foot, and mouth versus monkeypox is hand, foot, and mouth doesn't really have that prodromal syndrome that we see in monkeypox. So you don't really get that headache or muscle ache or whatnot before the lesions present.
Okay, thank you. So can people get from person to person? You said yes, right? It can be spread through the person to person. Am I correct?
Yeah, so the monkeypox outbreaks that we've seen has predominantly been sexually transmitted. It doesn't mean that's a sexually transmitted infection just yet, but essentially through people who have had prolonged close contact with somebody else who has symptoms, or with other, we call fomites, or like towels, sheets, or whatnot that have been in contact with somebody who has been infected. So that is a predominant way that we have seen transmission of monkeypox. We have seen it also in this particular outbreak, mostly in the gay, bisexual, and men who have sex with men community, not because it's limited to that community, but just because they have a higher kind of a percentage of exposure and prolonged contacts, and generally outbreaks kind of were within activities that included kind of sexual relations, and that may have had multiple partners that may have provided the fuel and the vehicle to spread this outpox. It's really important to note that anybody, though, can get monkeypox.
Okay.
And it's not necessarily just sexually transmitted, although that's predominantly what we're seeing it in. And you don't have to be gay or bisexual or men who have sex with men to get it, although that's the population we're mostly seeing it at. There has been cases documented in heterosexual people as well as in females and children, although those cases have been low at this point.
Okay, thank you for that. Because I was like, I'm gonna ask you who's the most population who got been affected right now. But thank you for giving me a heads up thing. So how can I protect myself from others against the monkeypox? Like, let's say if I have the monkeypox, right? What should I do to protect others and as well as myself too? What sort of treatment should I be doing?
Right. So, there's different ways of approaching this. If you have lesions or you have symptoms that you're worried, minimize contact with other people, and definitely get in touch with your healthcare provider. Let them know, and let them know of any potential exposures that you may have, and they would go forth into organizing testing through public health. During that time, you'd want to minimize sexual contacts. You'd want to make sure you're washing your bedding and decreasing contacts with people outside of yourself, including those inside your household, because potentially, again, it's close contact transmission that you could spread it to people in your household. Now, if you think you've had an exposure, for example, whether it's been through a sexual contact or a close contact exposure or a household exposure, or you're a healthcare worker, for example, you would want to get in touch with your healthcare provider or Toronto Public Health, and they would guide you as to what to do. They usually will monitor for symptoms, and we do have a vaccine that we are advising for high-risk exposures as well as for high-risk groups.
So, talking about a vaccine, so what does this vaccine do to the monkeypox? How are we? Is it like a medicine? Is it like we are protecting from the self, or is it? Why are we taking this vaccine from?
Right. So the vaccine is actually a smallpox vaccine. Smallpox was, eradicated back in the 70s, and the smallpox vaccine was kept in stockpiles in the case of the situation where there is outbreaks of smallpox or bioterrorism. We know that the smallpox vaccine has actually protection against monkeypox up to 85%. And unlike the vaccines that were given, I'm sure people who were born before the 1970s remember getting their smallpox vaccine, or they have scars from it, and they remember they were inoculated and they had some blistering and some scarring. The vaccine that is available right now is called Imvamune, and it's a third generation vaccine. And so it's still a live vaccine for that's used, but it's not kind of scarring and as painful as the original smallpox vaccine was. So that's where the vaccine comes from. And there is about like I said, 85% coverage and protection against monkeypox that was done in animal studies and for safety. And so that's the vaccine that has been rolled out. Currently, the vaccine is being used in very targeted populations in Toronto and Ontario, especially for those who are highest risk of exposure. So currently, those who are eligible for the vaccine would be somebody who's had multiple sexually transmitted infections in the last 2 months, anyone who's, MSM, bisexual, or gay, who has had multiple partners or is planning on having multiple partners, or have engaged in high-risk sexual behaviors where potentially you could have high exposure, such as going to bathhouses, and also for those if they've had a potential high-risk exposure, for example, if they're a household contact or whatnot. So those vaccines are available to that criteria currently. And to find out where to access those vaccines, you could look on the Toronto Public Health website or the toronto.ca website. And I know that the groups that we've been working with in the community, we have rolled them out in some of the COVID vaccine clinics. You'll see at some of these COVID vaccine clinics that are administering booster doses are also administering the Imvamune vaccine. One of the things to note, though, it is advised to have a 4-week window between getting your COVID booster and the Imvamune vaccination. However, if there's been a high risk exposure, somebody's worried and needs to get the vaccine, that can be, discussed, and it can be done on a case-by-case basis.
Okay, so if a normal population, if they're really scared, if they want to get the vaccine, just ahead of time protection, so they need to consultation with the doctor. Is that what you're saying?
Yes, at this point in time, if you fall outside of the eligibility criteria, you wouldn't have access to the supply across Canada right now. I believe it's something like 70,000 doses. Mm-hmm. As things develop, though, with monkeypox, we'll see what happens. We know just a few days ago, the World Health Organization declared this a public health emergency of international concern. This happens when there is a concern for something like an infection to spread beyond borders, and that would require international cooperation and work to contain. And so in this situation, this outbreak has spread to 78 countries and there's over 20,000 people infected. And this is probably an underestimate. In Canada itself, there's 745 cases up to date. And so as this situation develops, we may, the vaccine may be eligible to others outside. At this point, it would only be if there's consideration again for household contact or high risk exposure for a confirmed or probable case. And again, that would be on a case by case situation. It's something that you contact Toronto Public or your healthcare provider, they'd contact Toronto Public Health to discuss.
Okay, thank you for that. So you since we're talking about vaccine, so this vaccine has not been like a discover, like a COVID vaccine. It was really quick. The way they found it, that's the reason most people are afraid to get that vaccine, right? So this vaccine is basically, it's been founded like years before, right?
Yeah, this is not a new vaccine. Okay. It's been around, and like I said, there has been stockpile for protection against, and we know that smallpox, was one of the largest and most successful vaccine campaigns in history. And the virus was actually eradicated in the 70s. And so they stopped vaccinating in the 70s because there was no need to continue to vaccinate. However, again, with concern of the spread of smallpox, which caused a lot of damage and a lot of death around the world, these vaccines were kept and stockpiled for the use if needed. And in this situation, those vaccines were available. And again, there is cross protection because, again, monkeypox is a close cousin of smallpox, although it's not as severe a disease, and it's not something which caused as much mortality or death compared to smallpox, which is also a bonus.
Yeah, as a smallpox, yes. Thank you so much. But I want to go back to the spreading. I know it's like by sexual relationship and then close contact, you could get that monkeypox. I'm just wondering, if somebody touches you, would you be able to get that monkeypox? Like, let's say somebody have it, that person comes and touch you without having like a very close contact, just touching, breathing, being in the same room. Is it something that can be spreadable?
It just really depends on how contagious and transmissible they are, and it depends on how how symptomatic they may be. At this point in time, we don't believe that it's spread airborne. However, they're still kind of looking at that. But, from the cases that have been reviewed and researched currently, the transmission has been through close, prolonged contact. So sexual activity is a prime example of that, where you have close, prolonged contact, or if you have close, prolonged contact with like mucosal surfaces. So a lot of the infections that we see are related to mouth and the face surfaces, as well as the anal rectal surfaces and the genital areas. However, we have seen pox lesions on arms and hands as well, and on chest surfaces. And so potentially, if somebody had an infective pox lesion on their skin and touched somebody else, potentially, that could transmit the virus. But again, close, prolonged contact is key. And the same thing with with surfaces that have been exposed to this virus, such as bedding and towels and whatnot. So it is recommended that if you have monkeypox or you have symptoms of it, that you're washing bedding, washing towels, wiping down surfaces in the household, such as door handles, any horizontal surfaces that could harbor the infection, that you're disinfecting those. Okay.
Thank you for that. And then I'm just wondering, if a person got a monkeypox, are they vulnerable to get it again?
So likely not, but we don't know right now. Okay. So it's kind of too early in this outbreak, in the situation. Monkeypox is not something that we typically have seen. A lot of physicians have seen. Yes, monkeypox has been around in Africa for many, many years, and it's a disease that unfortunately has not had a lot of attention or has been neglected in regards to treatment and research. And so there's going to be a lot that we learn coming out of these outbreaks as this infection spreads.
Okay. Something that I wanted to find out. I know the monkeypox exists like since 1958, and it's been in the South Africa basically like a very small percentage. It's not even a high percentage. But 2022, we've been talking about it a lot, and then we've been hearing there's like more cases, even more cases is coming along. Is there anything you could think about it? What's the reason it's causing in the other countries, like especially 78 countries?
Yeah, so it's not specific to South Africa. It's Central Africa, so kind of in the Congo Basin that we kind of see those cases mostly, and West Africa. So countries such as Liberia and Nigeria have had cases. There's a lot of research going into why there might have been spread, because a lot of the cases that were picked up in the initial outbreaks in Portugal and the UK and some of the European countries didn't have travel specifically to these countries where the virus is endemic. And so there were some speculations whether there were some super spreader events, for example, that had high sexual activity or multiple partners engaging in sexual activity in these events that may have spread and resulted in transmission when people kind of returned home to their different respective countries. It's hard to say whether the virus maybe has mutated in a way, and that's why it's all of a sudden more transmissible and infectious. And so this is something that's being looked at and researched right now. The actual origins of where this monkeypox outbreak has really started from. We know obviously that the clades match the Western African ones, but the reason why it's spreading so quickly and kind of to different countries, this is still being examined, and there's like a research task force through the World Health Organization who is looking at that.
Okay, thank you for that. We know that monkeypox, anybody can get it. The children, especially most vulnerable, are bisexually and everything. And I'm just wondering, what about like a people that if a pregnant woman who gets it, or what is the risk of that?
Right. So there has been some cases of monkeypox in pregnant women. So monkeypox can be transmitted congenitally, meaning that it can be passed from mother to baby, especially during birth, if there's congenital lesions. There have been some reported cases of stillbirth and preterm labor and complications that have resulted in severe issues in pregnancy. And so it is something that can cause harm in pregnancy if one were to get monkeypox while pregnant. If you're pregnant and have a high-risk exposure, whether it's a sexual exposure or a contact with a household member or healthcare, we don't typically vaccinate pregnant women with live vaccines. However, in this case, this type of vaccine is something what we call a non-replicating. So it is something that would be given in pregnant women in the case of high-risk exposure. And so again, this would be done on a case-by-case situation. If they were exposed, they would have it. Now, if you were to have monkeypox, then we don't necessarily vaccinate, right? Because vaccination is not a treatment. The vaccination is for prevention. So it'd be either before exposure or after high-risk exposure that we vaccinate before you develop symptoms. Once you develop monkeypox or symptoms, vaccination isn't what we use for treatment. Most of the time, what we call it is self-limiting, meaning the disease will run its course and most people will do well. There may be some that have complications. A small percentage may result in death, although out of the cases that we've seen, there haven't been any deaths yet in the outbreaks that we've seen. So there is a treatment, an antiviral has been used in the past for smallpox, and that's called Techaviramate. And this would be used potentially in very severe cases in hospital on a case-by-case situation. And there have been a few cases where it has been used in Toronto and Montreal, for example, but it has been few. And this treatment is not available for everybody, but it is available in the case there were severe. And they require hospitalization.
So let's say if somebody, especially when they're mother, when they get it, there's nothing else there. What is the simple thing they could do to help that child? What sort of do they get really itchy, and then how do they sort of like, how do they treat them, like, in those cases?
So right now, I think there's only been a handful of cases in the US that have been identified in children. I am not aware of any cases of children in Canada, although it is definitely a possibility. And those would need to be kind of handled on a case by case. I think the main thing is syndromic management. So managing fever, managing pain, headaches, muscle aches. And pain is one of the big things that we have seen from those who have had the monkeypox, especially if it's like kind of around the anorectal or oral lesions. Usually that pain can affect people's ability to go to the bathroom, or can affect their ability to swallow. And so pain management may be kind of a big thing in management and symptomatic relief. And that's really going to be the mainstay for most people.
Then thank you so much. I think most of the question I want to cover, you just said it by like as we going through. I think we covered a lot, and then I think we do have a more question about it as it comes along. And then I know I talked to a lot of residents, and people have a different question. At this time, I only have these questions for you, and I really appreciate you coming in and giving us a bit more information just to educate our public, and thank you for that. And then really appreciate it.
Perfect. Thank you so much for having me. And just essentially, what we have been doing for the COVID pandemic in regards to washing our hands frequently, hygiene measures, keeping surfaces clean, distancing, masking, staying home if you're sick. These are really going to be the same measures that are just as impactful when we're dealing with outbreaks such as monkeypox. But also in the case of monkeypox, minimizing sexual partners, minimizing unknown sexual partners, using protection all the time. So using condoms is going to be important to decrease the risk of transmission as well. Washing bedding and clothing and whatnot frequently. So that would be kind of the take-home message. And this is a very dynamic situation. It's changing fast as numbers creep up and as it's grumbling along. Keep an eye on public health bulletins, and we can always follow up with more information as needed.
So before we end it, I just want to know if there's any resources people can able to access to it, like finding out more information, how to protect themselves. Is there a website or call line, something like that?
Yeah, absolutely. So there's the Public Health of Canada website. The Canada.ca is a great one. Toronto.ca and the Toronto Public Health websites have a lot of great information around it, as well as information about eligibility for the vaccine and where vaccines are available. So that would be good places to start. You can always contact and have a discussion with your healthcare provider, and they would be able to guide you more in regards to that as well as certain sexual health clinics in the city would be able to provide some information.
Thank you so much for coming in, and then I think people will got a lot of more information on that. If you want to add anything to it, please tell me. We can do that, and then otherwise we're going to say goodbye to today's radio show.
Yeah,
and
that's
thanks
great.
for listening, guys.
Thank you so much. Take care.
Make sure to like, comment, and subscribe. And when you do subscribe, hit the little notification bell so you never miss out on any of our content. If you'd also like more, you can find us on our other social media platforms. And if you want even more, you can look at our website.